Good evening, welcome to Central News for Tuesday the 5th of November. I'm Hilary Entwistle. In today's news, a recent library conference held in Hamilton brought some international keynote speakers to the country who spoke on the way search engines are affecting the use of libraries. It was identified that some big changes need to be embraced by libraries if they want to survive in such a technologically driven society. University of Waikato librarian Anne Ferrier-Watson says the current library situation has seen a decrease in the amount of students using libraries and instead turning to the convenience of search engines.
Well, we're talking about the University Library, which serves the research and study interests of students and academics. Really, it's an essential tool in your toolbox as a student. So if you're not using the library, you're trying to build a house without some essential tool like a hammer. And it could be a manual hammer or an electric hammer. If you're not using it, then what are you doing? You're missing out. We have amazing resources and amazing staff to help connect students to the right info, so you'd be really stupid not to.
A recent survey revealed some insightful information about just how much women understand about endometriosis. Hamilton's Insight Endometriosis has taken the survey results and seen a need for better education within the community about the condition. Alongside seminars and presentations, Annette Evans from Insight Endometriosis says their team is also organising a fundraising night to raise awareness and support for the cause.
Our Purple Pamper Night is happening on the 20th of November, 6 till 8 at The Link, which is on the corner of River Road and Te Araha Streets in Hamilton. Cost is just $30. It's going to be a really fun night with all sorts of pampering things happening for local women. And we really appreciate support from our community for that, so we can carry on doing our community work.
Now for our region's weather. Wednesday for you, Hamilton. Raining, but it will ease as the day progresses, and so will the northeasterly breeze. Your expected high is 19 and an overnight low of 9. Tauranga, the same for you. Rain easing to a few showers though, and the northeast breezes are going to ease too. Your expected high is 19 and an overnight low of 9. Just ahead, patient care. Welcome to Central News on TV Central. Waikato District Health Board is currently running its annual Open for Better Care campaign, which aims to spread awareness of important patient safety messages. Harriet met with Vicky Parry from Waikato DHB to learn about these messages and their significance when it comes to keeping patients safe.
So what is the focus of your Open for Better Care campaign?
The Open for Better Care campaign is coordinated nationally by the Health Quality and Safety Commission, and it's being implemented within our Midland region. And for us here at Waikato, the next few months we're going to be focusing on reducing hospital-acquired infections by implementing reducing harm from surgical site infections.
And what are some things that have been put in place to help promote these messages in the hospital?
First of all, we've got really good senior management commitment and Board of Clinical Governance support, and that's enabled us to, just last week, we launched the surgical site infection surveillance campaign. We had a booth that was provided nationally. It was up outside the cafeteria where all our staff and visitors and patients come. We provided them with packs of information which gave them all the information they needed to know what they could do, both patients and staff, in regards to reducing surgical site infections. We also coordinated that we have an annual Infection Prevention and Control Week. We had a focus board which we focused on patient and staff engagement with hand hygiene. We launched new resources of hand hygiene. We also have our infection prevention and control staff out in the clinical areas promoting and supporting the campaign.
And what will be the effect of the outcome for patients when it comes to reducing surgical site infections?
Well, for patients, hopefully the aim is to provide them safer care while in hospital, and so they'll be able to get home quicker. Because if we can reduce a surgical site infection for them, then it means that they'll have a shorter stay in hospital, they'll have a better outcome. But if they do develop a surgical site infection while they're with us, we will be able to provide them quicker and more appropriate treatment for that infection.
So for those who may not know, what actually is a surgical site infection, and I guess why is it such a problem for healthcare providers?
Yeah, well, surgical site infection is when a bacteria enters a surgical incision and it starts to multiply in the tissues. It then goes on and causes the patient pain. It can cause redness around the surgical incision line. It can also produce a discoloured discharge and a fever for the patient. It's such a big problem for healthcare providers because firstly it affects the patient. For the patient it can cause them pain, increased length of stay, it can cause financial hardship, and at times it can cause their death. Secondly, it does cost the healthcare system. When you develop a surgical site infection, it can cost twice as much than that of someone who doesn't have an infection. And for an example, if you have bypass cardiac surgery, you develop an infection, it can cost up to $45,000 per patient per infection. So that's a significant burden on the healthcare system. But also, thirdly, it does affect the length of stay, so it prohibits us to move patients through and those unwell patients to get them in and get treatment when they require.
So how long is this campaign set to run, and will there be sort of different topics through the duration of the campaign?
The surgical site infection campaign will run to March 2014, but then the whole Open for Better Care campaign will run until the middle of 2015. We've had two topics so far, the falls. We have got the surgical site infection, and also what will follow is surgical safety and medications.
Just how important is it for healthcare workers to acknowledge their mistakes, and why is it so important?
I think it's really important for us as healthcare workers to acknowledge our mistakes so we can keep moving forward and learning, and our whole aim is to provide a better experience for the patient and outcome.
What has the feedback been like from the campaign so far?
It's been really great. With the first campaign, the Falls, it's just finishing. That enabled us to involve areas within the organisation which we haven't involved in campaigns like this before, such as our outpatients. It also enabled us to do a little bit of community campaigning, so we provided these patients and visitors that came through our outpatients department with the information for them to take that home and to assess their risk of falls at home and what they could do to prevent that as well. For us with the SSI campaign, surgical site infection, it's not a new initiative for us. We've been doing surgical site surveillance on the three most highest surgeries which can cause infections, such as cardiac thoracic surgery, orthopaedic hip and joint surgery and caesarean section. We've been doing that for a number of years, looking at our practices, our infection rates, and putting nationally recognised best practice guidelines in place to improve our infection rates. So this Open for Better Care campaign is just adding on what we do, and it allows us to consolidate what we're doing and open it up to all surgeries within the organisation, not just the high-risk surgery ones.
So how can people learn more?
Well, they could go to our Waikato District Health Board website. There's also the Health Quality Safety Commission website that they can go to as well.
For more information, visit waikatodhb.gov.nz. Coming up after the break, we learn how to walk the talk. Welcome back. We all know that abuse of women and children happens everywhere in the world, and most of us want to do something about it. But how many of us walk the talk?
Well, Walk the Talk event that's coming up on the 16th of November is a Soroptimist International inspired event that is designed to say no to violence against women. It's a time where the United Nations sets aside 16 days for groups like ours to act in some way to promote the no to violence against women facet. So Soroptimists of the North region here are meeting in Matamata on November 16th, and we thought, perfect opportunity to say no to violence against women in a positive way, and we decided to do an event called Walk the Talk, and we're going to walk along the main street of Matamata peacefully We're not sort of out there demonstrating rah, rah, rah. We're just quietly saying we don't condone any form of violence towards women. And if you want to join us, come on, do so. So that's what we're going to do. As well, we're going to host a special community information talk by a man called Alan Bell, and he's going to share his insights into something that I don't know whether Matamata would have too much knowledge about, but it's ending child prostitution and pornography and trafficking that unfortunately is happening here in New Zealand. So we're just there to raise awareness of some of these things. It's more common than you would think. I mean, prostitution itself, child prostitution itself, there was some research done in about 2008 to say that there's evidence of at least 200 child prostitutes in New Zealand. And we think, I mean, 2008's a long way down the track, just imagine what it is these days. Trafficking's a little different. New Zealand seems to be a transition space for international trafficking, stopping off in New Zealand before they move elsewhere. But unfortunately, there is internal trafficking within New Zealand, quite often disguised as kids being sent off to extended family members and so on and so forth. And in actual fact, they're being subjected to sexual abuse of all sorts of kinds. So it's out there, and Alan Bell can really fill us in with the details of those sorts of things.
So who's Alan Bell?
Alan Bell's the CEO of an organisation called ECPAT, and ECPAT is to end child prostitution, pornography and trafficking here in New Zealand. And he's done a lot of work in Thailand. There's been a lot of sex tourism, I think you might call it. And people tour to Thailand and places in Asia for the specific purposes of sex and all that goes with it. And children there are being exploited. And Alan was just horrified to find out about this, and he's become involved in making people aware, not just here in New Zealand, but all over the world. He's very into it, and he's kindly said yes, he'd come to Matamata for us and share that, his information and what he knows about it.
And I guess, yeah, if something isn't done
and
soon,
if our generation don't get to know about it, we're just blithely going ahead thinking that the world's a reasonable place, but in fact there's some things out there that people need to be made aware of.
And so you guys are going to be wearing orange, and you're wearing orange today. What's the significance of orange?
Orange is the universal colour. It's a warning colour, and we're warning of the dangers of sexual abuse. And so worldwide, the wearing of orange indicates that we're out there warning people of the dangers and saying no to violence of any form in terms of women and children and so on. So orange is the colour of anti-violence.
What days, just remind us quickly again, what days should we be wearing orange, and what days can we walk the talk?
This is what's going to be floating around, walking the talk on November the 16th, Saturday, November the 16th here in Matamata, and we'll be meeting at the Matamata Club, 12:15, and we'll be walking not on the street but on the footpaths so that we don't cause havoc or distraction to any traffic and so on. And we'll be walking up Broadway, depending on the weather, whether we include Arawa Street and so on. So between 12:15 and 1:15, you'll see these people dressed in orange walking the talk, and we're inviting the public to join us so they have an opportunity to give witness to their belief that there should be no violence towards women and no violence towards kids. So
it's definitely a strong message. Thank you very much, Heather.
Thank you.
If you'd like to find out more, you can visit Soroptimist International, South West Pacific's website, which is siswp.org. Just ahead, it's time to start sprouting a moustache again. If you've just joined us, welcome to Central News. November is becoming increasingly linked with Movember, the Men's Health Month that sees money raised for men's health issues throughout the growing of moustaches. Loved by some women, but hated by others, the moustaches are already sprouting across the country. Harriet Wilson caught up with Hamilton Cancer Society to find out more.
So Sarah, what does the money raised from Movember go towards?
Well, it gets split between the Cancer Society of New Zealand and the Mental Health Foundation of New Zealand, about 50-50 split, and it's used to help achieve the strategic goals of the Movember Foundation, which are, things like prostate cancer research, initiatives to help men and promote men's health, and stuff about survivorship, so initiatives to help men after they may have had prostate cancer and the recovery process and how life goes on following a diagnosis like that and the treatment processes. And one of the major things that has come out of the funding from Movember is a website called Get the Tools, which is designed specifically to help men talk about their health.
So this Get the Tools website, can you tell us a little bit more about that and what's actually available to men on that site?
Yeah, sure. It's a really exciting initiative, and it's designed specifically for men to talk about issues that affect them and to find tools to help them find out, what things are meant to look like and what kind of changes they should be looking out for. And it's written for men by men, and so it reads like you're talking to your bloke next door and your best mate kind of thing. So it's really good in that sense. It's not medical jargony or anything like that, and there's a lot of resources on there for different things, like for outdoor workers about how to be safe in the sun and keep themselves protected. There's things there about prostate cancer and bowel cancer, which are the kind of more common ones for men, particularly as they get older. There's support for men, like to show them where they can get support if they're going through anything like this. And there's also, promotions that are going on, so information about like Movember and other things that men are doing to raise awareness around these kind of diseases and so on.
And why do you think that Movember is such a great event for men to get involved with?
Well, anything that gets men talking about their health and about the kind of issues that they're facing has got to be a good thing, really. And I think it's a really fun way to do it, and so it's not scary, it takes the fear out of it, and because kind of everyone's doing it, it makes it a bit more, seem a bit more acceptable to people to be able to talk about it. And it's also a really fun way to get, women involved and to get the kids involved, because they all want to know why daddy suddenly got a moustache.
Do you think that men have issues when it comes to openly discussing their health and perhaps their concerns about any health issues that they may be having?
Oh, absolutely. Yeah, it's been recorded that men are actually much less open about these kind of things than women, and the stats show that they go and see a doctor a lot less regularly than women do, which in turn means that their levels of diagnosis are lower and they get diagnosed later, which is really, really poor for the statistics and mean that they, the sooner you find something, the earlier, the better it is for treatment. And so it's really important that we do talk about these things and encourage men to open up, because they are notorious about the attitude of she'll be right.
So are there any ways to prevent these forms of testicular or prostate cancer in men?
Unfortunately, they haven't found anything that's like the one key thing you can kind of do. And so it's a little bit more broader about having certain lifestyle choices, and they can help reduce your risk of all types of cancer, including like testicular and prostate and bowel cancer. And these are the kind of things like quitting smoking or not starting if you aren't a smoker already. If you drink alcohol, to do so in moderation and make sure that you do have some alcohol-free days every week and don't overindulge in alcohol. Things like just lifestyle choices in terms of how you're eating, your eating habits, eating fresh fruit and vegetables, and also making sure you exercise and try and maintain a healthy body weight. So it's kind of simple things that your mother used to tell you to do.
And what should men do when it comes to having checkups or getting tested?
Sure. We recommend that men get regular checkups with their doctor, so say a yearly checkup, and then also just be a little bit aware about your body. If you notice something's not quite right, you're feeling extra tired and there's not really a reason for it, or something's not feeling right, go and see a doctor. Don't just put it off because you're a bit afraid, or lose that she'll be right kind of attitude. Go and get it checked out, because you know, you're the best person to know when something's not right in your body, so pay attention to what it says. In terms of screening programs or anything, talk to your doctor, because there are sometimes cases where they might find something that it's not necessarily going to become cancerous or something, and it could just cause you know, unnecessary procedures. So we definitely recommend talk to your doctor before you go and do anything like that, and find out about the benefits and the risks associated.
Now, coming into summer, what should we all be doing when it comes to protecting our skin against the sun?
Oh, Kiwis love the summer and the sun, and we love going out to the beach and camping and all that, so it's really important that we are safe in the sun and we do take care of ourselves. And thankfully it's actually really simple. So it's 4 simple rules. So slip on a shirt or into some shade, slop on some SPF 30 plus broad spectrum sunscreen, slop on a hat and wrap on some sunglasses, and they kind of cover your bases to keep you protected.
And when it comes to sunscreen application, is there a rule for how much we should be putting on or when we should be putting it on? How can we sort of get it right every time?
Yes, so New Zealanders are also really bad at not putting on enough sunscreen, and so the rule is it's actually about 7 teaspoons should cover your whole body, and so that's your face, your arms, your legs, but it sounds like quite a lot. So you've got to really get it in there, rub it all in, and make sure you get the things like the back of your ears and the back of your neck, and just make sure you protect those spots. And you should also do it about 15 minutes before you go outside, and then when you hit the beach or you hit the park, reapply, just to be extra sure. And then things like, you know, if you go swimming or you're perspiring or anything like that, you should also reapply after that, and then about every 2 hours, just to be on the safe side. So there's quite a bit there that you do need to put on, but it will keep you safe.
And is there anything that you wish that you could let people know about skin cancer?
Oh, well, skin cancer is actually one of our most common cancers in New Zealand, and about 67,000 people get diagnosed with some form of skin cancer every year. But the thing is that 90% of skin cancers are actually preventable, and so that's where it comes into being really important that people do know the messages like slip, slop, slap and wrap, and follow them, because they can prevent themselves getting cancer by just following those simple rules.
If you want to get involved with Movember this month, visit the official website newzealand.movember.com. That is the program for tonight. If you have something you want to share with us, you can email us or like us on Facebook. We would love to hear from you. Harriet Wilson will be here tomorrow night with more news from the Waikato and the Bay Plenty. I'm Hilary Entwistle. Have a lovely evening.
This has been an Alpha Media production, a division of Television Media Group.
Supporting local content so you can see more of New Zealand on air.